Currently, there is limited data supporting the use of periurethral bulking agents in men with post-prostatectomy incontinence. Here we outline the steps for periurethral bulking using Bulkamid for a man with recurrent stress urinary incontinence after placement of an advanced male sling.
This is a 59-year-old male who suffered from stress urinary incontinence following radical prostatectomy in 2022. He was using 2 to 3 diapers with insertable pads per day while at work and most nights. Anxiety surrounding his incontinence also impacted his sexual function. The patient elected to undergo placement of an advanced male sling in November of 2023. He suffered no complications and his recovery was uneventful. On follow-up evaluation, his incontinence was improved. However, he continued to have intermittent leakage, requiring use of 1 diaper at work and at night. In an effort to optimize his continence, we decided to pursue periurethral injections with Bulkamid. Here you can see our operative setup. We used a 22 French rigid cystoscope, a 30-degree lens, and a coaptite injection needle.
The procedure begins with cystourethropy, visualizing the vescourethral anastomosis. There is appreciable coaptation of the urethra in the setting of prior male sling placement. The coaptite needle is advanced while in the bladder lumen and primed with the Bulkamid injection solution. Our initial injection is placed at the 5 o'clock position. The opening of the needle is angled toward the urethral lumen to facilitate submucosal injection of the Bulkamid solution. We chose to place our injections approximately 1.5 to 2 centimeters from the bladder neck. The Bulkamid solution is injected until the mucosa expands to reach the midline of the urethral lumen. Injections are then performed at the 7, 10, and 2 o'clock positions until we achieve complete coaptation of the urethra. Here you can see the end result after Bulkamid injections are complete. There is complete coaptation of the urethra just distal to the bladder neck. The patient suffered no complications and had an unremarkable recovery from his procedure. On follow-up evaluation, he was found to be completely continent at night. He wore a diaper as a safety measure during the day, but no longer experienced urinary dribbling or leakage at work. He was very satisfied with his result. Periurethral bulking in men with stress incontinence is less commonly used due to its poor long-term outcomes. Male slings provide a viable treatment option for men with mild symptoms. However, a percentage of patients continue to experience intermittent leakage post-operatively. New bulking agents, such as Bulkamid, provide a means to optimize continence for this small subset of patients. We believe their use in this setting should be investigated further.